Coronavirus timeline leading up to Wuhan's lockdown shows clear signs of cover-up. Or at the very least, a failure to take the virus seriously. As of mid-March 2020, COVID-19, the illness caused by a new type of coronavirus first found in the city of Wuhan, China, has infected over 80,000 people with over 3,000 deaths. The Chinese government has been widely criticized for attempts to cover up the outbreak and downplay its severity in the early days. As a result, containment of the coronavirus failed and the exponential spread of the virus overwhelmed China's healthcare system. The government was forced into a rare public confrontation with its mistakes and swiftly implemented drastic lockdown measures, which have proven effective. But the question remains, when and what did China cover up, and how could this have gone differently? Beginning in early December 2019, doctors in Wuhan became alarmed by strange cases of respiratory pneumonia that showed up in multiple hospitals. China began sending information regarding the virus to the World Health Organization and other countries in early January 2020, but tried to keep the virus a secret from its own citizens. No new cases of the new coronavirus were reported while annual local and provincial political events were in session. Initial diagnostic criteria for the coronavirus were set too high and the number of infected people was much higher than in official reports. After denying or downplaying the contagious nature of the virus, China alerted the public of the severity of the outbreak and imposed a lockdown on Wuhan city. In clinical features of patients infected with 2019 novel coronavirus in Wuhan, China, a study published by the medical journal The Lancet in late January. Researchers claimed that the first case of the novel coronavirus appeared on December 1, 2019. The individual had no link to Huanan Seafood Market, the live animal and seafood wholesale market in Wuhan where it is suspected the virus originated. Official reports from the Wuhan Municipal Health Commission, WMHC, dates the first case as of December 8. On December 20, Winner Medical, a company that supplies hospitals with masks and bandages, cancelled its annual gala in Hubei province. On Christmas Day, a hospital director was alerted about medical staff getting infected by an unknown disease at two separate hospitals. The next day, a Wuhan hospital reported 4 cases of an unknown disease to Wuhan Center for Disease Control and Prevention, Wuhan CDC. A sample of the virus was sent to the Shanghai Public Health Clinical Center to be studied. On December 29, the same Wuhan hospital issued alerts to local, city, and provincial CDCs, prompting the WMHC to send a team of infectious disease researchers to the hospital. Editor's note: Coronavirus disease 2019, COVID-19, is an infectious viral respiratory disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, also known as novel coronavirus. On December 30, 8 whistleblowers posted information regarding the virus on social media, only to be reprimanded by local authorities. The next day, Wuhan Union Hospital set up a quarantine area. And an unnamed hospital received written orders from authorities to investigate the contact histories of patients who had been to Huanan Seafood Market. The market was immediately disinfected and officially shut down 1 day later. The WMHC reported 27 cases on December 31 as a team of experts from the National Health Commission arrived in Wuhan. Still, the WMHC stated that they had not found any obvious human-to-human transmission or infection of medical personnel. Hong Kong received news of the situation and began preparing preventative measures on January 2. On January 3, China began sending information regarding the virus to the World Health Organization, the United States and neighboring countries. Upon receiving the news, Singapore started taking the temperatures of passengers arriving from Wuhan. Meanwhile, the WMHC recorded another 44 cases and again stated that there was no obvious human-to-human transmission. A whistleblower, Dr. Li Wenliang, was forced to sign a letter of admonition at the police station for spreading harmful rumors. Given the chance, how much earlier could the alarm bells have gone off in Wuhan? No new cases of the new coronavirus were reported while annual local and provincial political events were in session. On January 6, Wuhan kicked off its local 2 sessions. The annual back-to-back meetings of 2 of China's major political bodies, the People's Congress and the Chinese People's Political Consultative Conference, CPPCC. During these meetings, the WMHC reported no new cases of the coronavirus. Meanwhile, hospitals saw an uptick in presumptive cases. Doctors and nurses started getting sick. On January 10, Wuhan's 2 sessions ended, but the flow of travelers in and out of Wuhan had only just begun. This day marked the beginning of Lunar New Year travel season in China, during which about 3 billion trips take place in the span of 40 days. The WMHC confirmed 41 new cases the next day while continuing to insist that there was no obvious human-to-human transmission. From January 11 to January 18, Hubei's provincial 2 sessions took place. Again, no new cases were reported for the duration of the meetings. In an interview with Science magazine, a doctor from the National Health Commission went as far as to say that not 1 out of 763 people who interacted closely with a coronavirus patient got infected, and that the spread of the virus may end in a week. However, the official line began to waver, and they didn't rule out the possibility of human-to-human transmission. Initial diagnostic criteria for the coronavirus were set too high and the number of infected people was much higher than in official reports. Medical experts from Hong Kong, Macau, and Taiwan flew into Wuhan to investigate the situation. China's national CDC declared the highest state of alarm. A high-level official at the National Health Commission warned Guangdong Province's CDC of both human-to-human and asymptomatic transmission. For a second time, Wuhan University's Zhongnan Hospital reported to medical authorities that many of their patients were likely sick from the coronavirus but were not being diagnosed because the criteria for an official diagnosis was set too high. By January 19, 18 more healthcare workers had been diagnosed with the coronavirus. The National Health Commission began sending test kits to hospitals across the country. Meanwhile, Wuhan City held its annual mass banquet in the Bingqing district, which attracts tens of thousands of attendees each year. After denying or downplaying the contagious nature of the virus, China alerted the public of the severity of the outbreak and imposed a lockdown on Wuhan City. On January 20, China's State Council officially made the new coronavirus a disease required by law to be reported to government authorities. The nation's leading epidemiologist Zhou Nanchen, who had led China's response to SARS in 2002, went on national television to declare that the virus was most definitely being transmitted from human to human. The WMHC reported 136 new cases of the virus over a 2-day span. The next day, 72 new cases were confirmed. 1 day later, there were 105 new cases. Finally, at 10 a.m. on January 23, Wuhan City was put into lockdown. Undoubtedly there are many details and stories that have yet to come to light. It's the media's job to uncover them in order to get closer to the truth and understand what happened. About the authors. Chen Rui and Su Bingqing are reporters for YiMagazine, a leading financial news platform in China. YiCai Global, 2020.